for inviting me for this brief talk about my experiences. I'm, by the way, Dr. Subhash Uppal, cardiologist who retired in the Netherlands about 12 years ago. And after my retirement, I migrated to India and I chose Jaipur as a place to settle down. And I've never regretted that decision. Now, talking about my stay in Jaipur, I was struck by an encounter I had about 2 years ago at the Internal Hospital, where Dr. Sami Sharma, chairperson, and Mrs. Manju Sharma, co-chair, they invited me to attend a function during the opening of the emergency department, which was newly opened at that time, and I was privileged to open that wing on behalf of Ambassador Jadwal from New York. And there was discussion about different units which function in the hospital. At that stage, I thought Internal Hospital was basically a cardiology center because of Dr. Sami Sharma, who is the director of interventional cardiology at Mount Sinai in New York, as we all know. And but I was really pleased to know see the different departments. And during our round, department called the Wellness Center, and the Wellness Center I inquired was actually the preventive center where if you were having any questions about your heart health, one could get fully investigated. So at the Wellness Center, we had different tests like EKG and ultrasound, treadmill, and there was another test which I thought was very interesting, was CT angiogram of the coronary arteries, which I was not having any symptoms, but at the end of the day, I had a talk with Dr. Prem, cardiologist, who went through the reports and mentioned about the coronary angiogram, and that mentioned that I was having a higher calcium score, and that deserves attention because of my positive family history. You see, my both parents, they had cardiovascular accidents and they're cardiological patients, and he thought this is important that for me as 65 plus, I should try to reduce my heart risk by taking a small dose of aspirin and a small dose of statin. And I must say, I've never regretted this. I feel good. And but somehow it really struck me that he showed a sense of passion and commitment to take the time to listen to my history, examine me, and discuss the results of the reports all under one roof in the same day in a hospital. Which I thought was really wonderful compared to my experiences myself as a cardiologist in the Western setting. Now, after these 2 years, back to the story of this moment, that is, it started in New York. I was visiting my sister, and there I started feeling a little unwell, and because the time was really short, when I arrived in Amsterdam, where we live half the time, I went to the emergency department of the nearest city hospital, and there I was given to understand that I was having a rise in temperature and the urine was looking a little disturbed. So they gave me an antibiotic and asked me to report after 3 days at the emergency department. But overnight, the next day, I went from bad to worse and had to go to city hospital again with a worsening situation with the ambulance. My wife joined me and I was really in a bad shape. So at that stage, I was looked at by an internal physician who asked me to be admitted right away in the infection department and was told that I'm having urinary infection. So they took urine cultures and I was given antibiotic, and I stayed in the hospital for 2 weeks. And after 2 weeks of stay there, I was feeling better, and I couldn't wait to board the flight to go to India, and I reached Jaipur and felt okay. But within 2-3 days, I was having urine complaints again, and of course I didn't trust myself, my situation. I made an appointment with the Department of Urology at Internal Hospital. Dr.Ravi Gupta, the urologist, who said that you please, seeing your history recently in the urinary complaints, you please come tomorrow and we'll examine you. And I must say it was very, very nice to be greeted by him, and very warm, good vibes, and he examined me and then ordered a battery of tests like ultrasound, urine flow measurement, and the lab results, and of course the urine culture. And he said, I'll like to see you within 3 days because the urine culture report will be there. And indeed, the urine culture turned out to be positive with the same bacteria I'd been running while I was in Amsterdam. And but he sounded a little bit more worried, not because of my prostate enlargement, which was visible on the ultrasound, but more worried about my urine flow report, which had never been done in the past before. And he said, well, I'm not very happy about this, so let's try it after you come back again tomorrow, and we're going to evaluate it, pre and post your bladder being full. And then he came out with a very important conclusion that this is abnormal, this flow pattern. And it really points to serious prostate pathology blocking my urinary tract, and this needs to be operated. And I just couldn't believe it. I said, well, I'm somebody who's been doing always exercised, living by the book, and now I feel that I don't deserve it. He said, no, you don't deserve, but you definitely deserve good treatment. So tomorrow you will be admitted, and then after pre-operative evaluation, I was operated the next morning, and then endoscopic laser ablation was done of the enlarged prostate surrounding the urethra. And I can tell you, the whole procedure was a joy to watch on the TV monitor. Dr.Ravi Gupta explained to me all the stages of the procedure, what the pathology was, how the lesion looked like after the intervention. And I was completely awake the whole time because it was done under spinal anesthesia, and came to the ward. A beautiful place surrounded in a lovely environment around the hospital, all green, very nice. You feel very good to be a patient lying in a hospital and then still enjoy the nature looking through the window. And my attendant was also able to sleep in the same room, which is rather nice. And in the days to follow, I was taken into confidence by the other members of his urology department team, who were all committed, very passionate, and I must say there is a certain amount of trust which grew between us, myself as patient and all the nursing staff and the doctors. So I feel, if I look back, as I am told that I'll be discharged tomorrow to be able to go home, I feel very good about it, that I've been taken care of. My investigations were done as soon as possible, one after the other, and the surgical treatment was done almost immediately. And I was really treated to a homely kind of food, taken care of, and I feel good that after a successful treatment, I'm going home, and I feel, if I look back, that this is a place where as a patient you like to come to, you like to refer patients to go there, because there is something very, very passionate about the people who work here. And I think that's the secret of this hospital. I trust them, and they really take care of you. Thank you.